You know that moment we all dread? The one where you have to say something that you know is going to change someone's world forever? It's that conversation where every single word feels like it weighs 1,000 pounds. So how do you actually do it when you're in that moment? How do you find the right words? How do you show compassion and be clear when every instinct might be screaming at you to just get it over with, or maybe avoid it completely?
Well, here's something that might surprise you. In the world of medicine, where these conversations happen every day, they don't just wing it. There's actually a plan, a roadmap for empathy.
To really see how this works, let's follow a story. We're going to meet a patient. We'll call her Sarah O'Brien. She's 28, and she's on her way to what she thinks is just a routine follow-up appointment.
So here's the situation. Sarah's recently had surgery for what everyone thought was a miscarriage. Today, she's just coming in to get the lab results. But what she doesn't know, and what her doctor does, is that the diagnosis is something else entirely, something way more complicated.
So how does a doctor even begin to prepare for that? Well, they use a framework. It's called SPIKES. And look, this isn't some rigid script they have to memorize. Think of it more like a set of guardrails, a guide to make sure this incredibly tough talk is handled with as much care and clarity as possible. And here it is, the whole thing, SPIKES. It's an acronym for 6 steps: setting, perception, invitation, knowledge, empathy, and finally, strategy and summary. Each one builds on the last, and together they create a safe space for a conversation that feels anything but safe. So let's break it down.
These first 3 steps, S, P, and I, are all about laying the groundwork. You might think the most important part is delivering the news, but actually, what you do before you say a word can make all the difference. It's all about creating a foundation of trust. It all starts with the setting. I mean, this is the basics, but it's so important. Get a private room. Sit down. No standing over the patient. Make eye contact. Turn off your phone, your pager. It's these tiny things, right? But they send a huge message. Right now, you are the only thing that matters.
And then the doctor asks Sarah this simple but incredibly powerful question. Right there, in one sentence, she's offered support and handed Sarah a little bit of control in a situation that feels completely out of her control.
Okay, next up is perception. You can't just jump in with the facts. You first have to figure out where the other person is coming from. So the doctor needs to know, what does Sarah think is going on? What is she expecting to hear today? This helps tune the conversation to where she is emotionally.
And the doctor does it with a question like this. Now, they're not quizzing her, they're listening. Sarah's answer is going to reveal everything. If she's scared, if she has it all wrong, and it gives the doctor clues on how to gently guide her to the truth.
Then we get to the invitation. Now, this might seem like a small thing, almost just a formality, but it's fundamentally about respect. Before just dropping this life-altering news, the doctor asks for permission. It gives Sarah a second to brace herself.
It's such a simple courtesy, but it's huge. It completely changes the dynamic, doesn't it? It's not the doctor talking at her anymore. It's them agreeing to walk through this together. When she says yes, they're ready.
All right, so this is it. We're at the very heart of the conversation. The next 2 letters, K and E, knowledge and empathy. This is where the news is actually delivered and where the immediate emotional fallout is handled. This is the moment.
So the doctor starts, but not with the diagnosis itself. They begin with a clear, simple, factual statement. In medicine, they call this a warning shot. It's a gentle heads up that serious news is on the way. And then, there it is, the diagnosis. Delivered clearly, without confusing jargon, the doctor says the medical term, but you can bet they're going to immediately follow up and explain what it means in plain English.
And right away, maybe before Sarah can even fully process the words molar pregnancy, the doctor says this. They know where her mind might go, that spiral of what did I do wrong, and they cut it off right at the pass. This is so crucial. And then, nothing. Just silence. This is maybe the hardest but most important part of the whole process. The doctor just stops talking. They give Sarah room. Room to think, to cry, to be angry, to just be. That pause is an act of kindness.
So you might be wondering, what even is a molar pregnancy? Well, basically, it's when the genetic material in a fertilized egg develops abnormally, right from the start. The key thing for Sarah to hear is that a viable pregnancy was never possible. It reinforces that this was nothing she did.
So during that silence, the doctor has shifted gears completely. They are now fully in the empathy step. They're not busy thinking about what to say next, they are just watching. They're present. They're paying attention to her reaction, whatever it might be.
And this is how they respond. Notice what the doctor doesn't say. They don't say, "I know how you feel," because they don't. Instead, they just name the emotion they're seeing. "This is upsetting," and they express genuine sorrow for her pain. It's about validating her feelings, not claiming to share them.
Okay, so after that initial emotional wave has been acknowledged, the conversation needs to move forward. The final step, strategy, is all about answering that silent, screaming question in Sarah's mind. Okay, so now what? It's about giving back a little bit of control. So the doctor lays out a plan, a real, concrete, step-by-step plan. And look how specific it is. We're going to get you registered here. We're going to do this test every week. Here's what you need to do next. This structure is the antidote to the chaos and fear she's feeling. It gives her a path.
And they wrap up the plan with this, an incredibly powerful, reassuring statement. It tackles the two biggest fears head-on. Am I going to die? And can I be fixed? It's a promise of safety and a message of hope.
So when you step back and look at what just happened with Sarah, you start to see it, right? The Spikes framework, it's not really just a medical tool. It's a lesson for all of us, a lesson in the power of having a structure for empathy.
Think about the difference. A conversation without a plan feels like you're lost at sea. It's confusing, it's isolating, it's terrifying. But a guided conversation, one that prepares and listens and informs and then makes a plan, that feels manageable. It makes you feel supported.
So here's the thing. We're not all doctors. We won't all have to deliver a medical diagnosis, but every single one of us will have to have a hard conversation at some point. And in those moments, when the stakes are so incredibly high, isn't a roadmap for empathy exactly what we all need?